So I'm now delighted to welcome our next speaker, who's Professor Erica Wood. She's going to talk about her career pathway, but also give us some practical advice on getting started and choosing a research project. Professor Erica Wood leads Monash University's Transfusion Research Unit and is a haematologist at Monash Health. She is an NHMRC Leadership Fellow leading the Blood Synergy Program and Centre for Research Excellence in Improving Immunoglobulin Use. Please welcome Professor Wood.
Thank you, Sophie, and it's really a pleasure to be here with you all today, and I have to say how much I enjoyed the previous presentations and discussions that I heard in the earlier sessions. So I'm a haematologist, and if you're interested in a career in research, you're going to have to get out of bed and do something that you like. So choose something that is worth getting out of bed for, which is how I chose my title for today. So all of my career is basically on this one slide, and I'm just going to go through it very briefly, but not with quite as many nice pictures as the previous speaker. So I graduated from medicine here on this campus a long time ago, and Professor Sue Walker and I were in the same tutorial group, and we're still friends, which is very nice. And then I went on to do my medical training here in Melbourne. And then I moved to the United States. My husband is an infectious diseases physician, and we were both interested in working overseas. And I hadn't quite finished my specialty training in haematology at that point. But I think one of the points I wanted to make in my talk was you never know where life's going to take you. Careers in clinical medicine, allied health, look, there are so many opportunities to have a good time and travel the world, as well as working very hard. So you just don't really know what's going to come next. I went to the United States thinking I wanted to be a bone marrow transplant haematologist, and I'm still very interested in that. But while I was doing my clinical work, the arrangements were that you had every few months you could do an elective. You were on call every other day, I have to say, for the entire year, except when you were doing your elective. But the person who was the head of the transfusion service at my hospital said, you're very good at this pathology stuff, and would you be interested in doing an elective with us in the hospital blood bank? And I was like, oh, maybe, yeah, maybe. And anyway, I did it. I really enjoyed it. And of course, I was training in both clinical and laboratory haematology for the colleges here in Australia. And I liked it so much, I did another elective, and it kind of changed the course of my career. And then I went on to become a transfusion medicine fellow in Cleveland, where we were living, and then I worked for the American Red Cross. And then when I came back, I had all my fellowships and came back to a job here at the Australian Red Cross Blood Service. And so I want to really frame the rest of my talk by saying I'm a bit of an accidental researcher. I was anticipating being a full-time clinician working in blood transfusion because that's what I really liked. And I only got into research by accident, but I've always maintained a clinical role, and when I came back from the United States, I was working at the Royal Melbourne. But I also put up my hand to do some work with the World Health Organization. They needed someone to come to the regional office in Manila, give some advice on some transfusion activities. We also set up a transfusion practice improvement program with the Department of Health here in Victoria, which is still going 25 years later. It's called Blood Matters. Some of you might be aware of it. Because the blood in the bag at this point is pretty safe, but how we use it, transfusion can really save people's lives, but also people can die. So people are going to have an ABO-incompatible blood transfusion or some other complication, or maybe there's not enough blood when they need it. So these things are all very important. We wanted to use the blood better. The other point I wanted to make about a fulfilling clinical research career is get involved with the professional societies in your area of interest. People can help you, they can nurture your research interest, they can give you lots of opportunities. We've had a long-standing collaboration with colleagues in Oxford, and I did my only sabbatical there longer ago than I should have had another sabbatical. But what I wanted to make with this point is to say, as the previous speakers have said, collaborate with people. You don't always know how to do everything yourself, but by working with other people who have different ideas, different skills, different resources, you can do more. When I came back from my sabbatical, I started working at Monash Health, where I still work, and I work 1 day a week clinically, and the rest of my time is now in research, but it wasn't always like that. At the same time, still working at Lifeblood for most of my job, we set up a new partnership between Lifeblood, what's now called Australian Red Cross Lifeblood, and Monash University in the School of Public Health for a new transfusion outcomes research collaboration. And that grew into what I now do. But I've also been involved with government. This is the National Blood Authority. Sorry, my vision isn't that good, so I'm turning around to look on this screen. But the National Haemovigilance Advisory Committee was the first national government committee I was involved with. I then got involved with the International Society of Blood Transfusion and was served on the board for a long time, including as president of that society. And just to echo that sense about getting involved with professional societies, you can learn so much, not just about the content area in your field, but who is who. You can learn, you can meet all these people from other countries, great people to work with in your research. I've served on the TGA various advisory committees over the years, where I've learned a lot about regulation of medications, which has been very helpful, and been involved with the International Haemovigilance Network, which I also served as president. I was chief examiner in haematology for the College of Pathologists, so I think you can see that I'm not very good at work-life balance or saying no. And I heartily agree with the people who said earlier in the day you should try and find a work-life balance. I haven't found one yet, but I have to say, if you're having a good time doing the things that you like doing, it doesn't all feel like work. In fact, many times it feels like just an enormous privilege. So the transfusion research unit that I now lead, we have about 45 staff and students in the School of Public Health, and we collaborate with many people, which I'll mention in a minute. The School of Public Health runs more than 40 clinical registries, and we run 10 of those, and I've put some examples here, including for lymphoma and myeloma. Now, I'm not a lymphoma or myeloma type of haematologist, but I work with people who are, but we are very good at registries, which is why people come to us and say, can you tell us if we should run a registry in this? We also do clinical trials and lots of other things. And we've been very successful with NHMRC funding, for which I'm very grateful. And we were in the first group of research collaborators to be awarded an NHMRC Synergy program, for which we were delighted and enormously surprised to be the top scoring application in that year, for which there was a wonderful prize presented by Fiona Stanley herself. And then we've received some other activities funded by MRFF and others to do work in how we can improve the use of blood products. So these are donated by the community as volunteers. We are paying for them in our taxes, billions of dollars a year spent on blood products. But if we give the blood to the wrong person and they die, I'm not saying this is just a waste of money. This is terrible. So we need to do this much better. So along the way, I've had many other opportunities with WHO, with various government committees, and I've learned so much from all of these. I've been associate editor for Blood, which is the top haematology journal internationally, from the American Society of Haematology, and I was enormously pleased to be elected to the Academy, and in the same year awarded an AO. And I can tell you that I was the second most person pleased about the AO after my mother. Anyway, we did receive a second Synergy just last year, which has been enormously important in funding our research. The ability to get 5 years of Synergy funding is just such a relief that every researcher in the room will tell you. And I've been very fortunate to have 2 investigator grants, which has given me the protected time to do this research. I love clinical medicine, but I also love research. Now, one thing on this slightly laborious timeline, for which I apologise, but I thought it was important to say that there's one thing that you might think is missing here. When did you do your PhD? Well, I don't have a PhD. I didn't do one. I wasn't planning to be a researcher. If I went back and did things differently now, maybe I would do one. I can see the value in it. But at the time I decided to go into research, I was not thinking of how I would need a PhD. And I'm very fortunate to work with a lot of people with PhDs who make up a fantastic team. But that's not been my career path. So I just want to encourage people that there is no right or wrong way to have a career in research. I think it's fantastic for people who know what they want to do and say, I'd really like to get a PhD because this will help me in these ways. But you can do research without having a PhD, but it also means you need to surround yourself with excellent people with all the skills. I'm truly an international expert in transfusion medicine, and I bring something different to the table in our team than other people in our team. But it's about a team, as our previous speaker emphasised. So this is our team. We're interested in transfusion medicine and in many other aspects of blood disorders. And you can see some of the things we do here, not just transfusion medicine, but people with blood cancers like lymphoma, myeloma, leukemia, bone marrow failure like aplastic anemia, haemoglobin disorders like thalassemia and sickle cell disease, and also other areas where blood is used like trauma and obstetric and other hemorrhage. We run a range of different types of activities, so clinical trials and registries. And we're also working in areas where you might think the evidence base for how we use transfusion would be good, and it's absolutely rubbish. So for such a very common procedure in hospitals, we have no idea in most cases about the outcomes for patients. Are they better after receiving a blood transfusion? How do we measure that? What are patient experiences, or PREMs, patient-reported experience measures? There is no single PREM for patients to report their experience after a blood transfusion. So anyway, that should keep me employed until I'm well ready to retire. And I mentioned our school runs a lot of registries, so if you're interested in registry science, that's a short promo for the School of Public Health, which run a lot. And you might say, Erica, well, why registries? That sounds a bit dull, sounds a bit dry. Well, this report from the McKeon report from more than 10 years ago now reminds us that registries are a way to measure our practice against guidelines, and that ideally these guidelines will be evidence-based. But you can see there's so much more we need to do to make these evidence-based. So choosing a project, if you're interested in transfusion medicine, there is no shortage of projects, let me tell you. But that goes for nearly everything. And one thing I remember from John McNeil, who is the former head of the School of Public Health and Preventive Medicine, is this really important but easy to remember saying. He said, Erica, every time you're applying for a grant or proposing a project, we need to be able to answer these 3 questions. Why this? Why this project? Why is it important? Why us? Why are we the people who should be doing it rather than someone else? And do we have the skills to do it? And why now? Why is it important to do it now? So I'll just cover a few aspects of that to flesh that out before I finish. So is it interesting to you? Is it interesting to other people in your team? When you're a junior researcher, you might be directed by people who know more than you about the field, about why it's important and interesting. But as our previous speakers have all said today, you can have your own ideas about what's interesting and pitch those to people with more experience than you. This is a team sport. We often need to take a very broad idea about some theme and translate it into a specific research question that we can answer with our project. Now, this project might be the first of many projects, or it might fit in with other people's projects, but we need to be able to answer a research question, so we need to formulate that. We need to be sure that it's not already been answered, so we need to do our homework to make sure why there is a need to do this. Is this important? Is it going to advance the field? Whether it's basic science, clinical medicine, is it going to advance government policy, for example? And is it an opportunity? Is it an opportunity for us, for our group, for me personally? Is this something I can do in my own studies? And what about other people? So when you're the head of a unit, you're thinking, could that be an opportunity for so-and-so or so-and-so or so-and-so? The idea is to give people opportunities. And then, as we were hearing before, it's not just the publication of the paper. That might be one of the outputs from your research. But what about the outcomes? When people are using this information, how will that improve outcomes? Whether it's clinical outcomes for patients, or how we use Australia's blood better, would also be an outcome. So we have to think about research translation. What is our long game to get this into policy and practice? And what will be the impact of our work? So sometimes we have too many choices and we have to think, can I do all of this work, or can I work with people? We can do it together. And I really liked the analogy, which I often call the pots on the boil analogy. So you might have multiple things going at once. Some of them might be long-term, slow-moving projects. But also, while that's cooking over here, you can do something over here, and then when you're attending to this, that one is happening in the background. So it's not wrong to be doing multiple projects at once. And in fact, that is probably the story of my life. But at the same time, you have to think, how can I manage these? And you also need people to help you manage them. So making choices about what you can and can't do can be quite hard. You don't want to not do something that seems very exciting. But you have to be realistic. So I like this little decision tree, which some of you probably know very well. It is often poorly utilised by many, even experienced researchers, and certainly it also describes my life very well. The answer is, look at this new shiny thing, can we also do that? And in my unit, we almost always say yes. Sometimes we should probably say no. So you do have to be realistic. So when you're being realistic, you have to think, what are the resources we will need to do this project? So a lot of research is about people. Who is going to do this work? It's nice to have an idea, but how are you going to actually deliver it? So who else can you get to help? Do you and these other people have the right skills and experience? Do you have a supervisor, especially when you're very junior? When you're my age, you can probably do a bit more what you want. Now, that might be very dangerous, but for most of your career, you'll probably be working with a supervisor. Has that person got the right skills and experience? And if you don't, but you all still want to do this, maybe it's an opportunity for collaboration. I'm not going to talk about laboratory research because I'm a clinical researcher, but some of the things that we might need to do to get started, even before we choose the project, are things like, do we need a scoping review? Is there any evidence out there at all that will tell us how we should direct our project? Or maybe there is evidence and we might need to synthesise it in a systematic review. Should we do a survey of practice, what people are actually doing, or at least what they say they're doing, which are not the same things? What data sources will be available? Do we need a pilot study before we launch into some 2,000 patient or 10,000 patient study? And who is going to do the design, conduct, analysis and translation? Now, when you're a junior researcher, you don't have any experience in all these aspects, but there are people who do. So try and join in with a good team. That's my other piece of advice, are people who know what they're doing in the area that you want to work in. So many people think if you want to have better medical research, you just need more doctors involved. Well, I'm sorry that that's not the case, even for the people who are training to be doctors. You actually need people with these types of skills. If you want to do a clinical trial, you need to work with people who've done a lot of trials, that sort of thing. But you also need people with epidemiology, biostatistics, health economics expertise. You also need people who can manage projects. This is very important because many people are not good at managing projects. And so you need to think about the time, your time, others' time, and now and in the future, and when those pots might be boiling. How long will this take? 1 year, 3 years, 5 years? Something like that. And again, these outputs, outcomes, translating the research, and what will be the impact. So if you can think in the big, if your vision is what is the impact, you can work back from there to try and work out how we make this all fit together. So this is nearly my last slide. It's one of my favourite slides about writing a paper, but it also doubles really here about doing research. So the vertical axis is general good vibes. And then along the bottom is time. And then you can see here things go up and down, and the vibes might be quite different from one moment to the next. There are some tough times in any research project and certainly in writing a paper, but it's a wonderful feeling to see your paper in print, which is the result of the work of hard work of many people. And then at the end here, this says, hey, that was fun. Let's do it again, only bigger. So research, it's very addictive. It's so exciting because there's so much great work to do and things to learn and great teams to work with. And then you want to do more. So my advice would be get involved, keep going, and you'll probably have a few graphics like this too. So, but research is fun. Here are some people from my team at one of our Christmas parties. I want to thank all of those people and all the people who've been involved in our research and of course many of our funding bodies. And just one community advertorial about please be a blood donor if you can. Not everybody can be. People do their public service in different ways, but if you can be, think about it, because only 3% of the population donate blood, but many of us and our families will need it in our lifetime, as will our patients. So use it wisely, but also if you can contribute, please do. Thank you very much.
All right, thank you so much, Professor Wood, for that talk. We've got time for a couple of questions from the audience. We'll just go on there.
Thank you. Thank you very much for the presentation. I love the graphic at the end as well. It's a really nice graph. You mentioned you didn't do a PhD. I think that's a stark contrast to the rest of the speakers we've had today. I just wonder was there any point in your career where not having a PhD was actually a barrier?
Not that I've seen so far. I think I would like to have had a PhD, and sometimes I've thought about going back to do one. And then when I say, or my husband sometimes says to me, has this held you back so far? And the answer is probably not. I mean, I would have had a different career if I'd had a PhD, no question about it. And there are some things that I would like to be better at that I'm not very good at. For example, we have some really excellent biostatisticians in our team, thank goodness, because I'm not good at stats. And when I was listening to the earlier discussion, and people were asking, anything you think would be helpful for people starting out in a research career. I have to say that having people who can do their own stats with the guidance of a biostatistician is a really good clinical research life skill. So I would encourage everybody to have at least basic stats, which of course people have to do as part of their PhD. I don't think it's really held me back. I feel happy with what I've been able to achieve. But as I said, I think I bring something different to the table, and I'm surrounded by really good people. So the thing I would recommend is join a really good team, or if you can't find a team that's doing that work, think about whether you can establish one. Doesn't happen overnight. Yeah.
Any other questions from the audience?
Thank you so much for your talk. Many of us are reaching out to clinician-scientists to ask for involvement in research. Do you have any suggestions on how to choose between different clinician-scientists within the same field?
Look, I think the first thing is to talk to as many people as possible. Do your homework, be prepared, know what it is that they do, read their papers, look up their profiles, don't go along, without doing your homework, because that's not good use of anyone's time. But I think it's really helpful to talk to people because we get a lot of emails, a lot of cold calling, as it were. But I think if you can say, I'd like to work with you because, I've read this paper, I thought it was very interesting, I like the kind of work you do. But also go and try and listen to those people if they're giving grand rounds or giving a lecture about something. You have to, as much as them choosing you, you have to think, is this someone I want to work with? Do I want to do a PhD with this person or be in their research team? So I would talk to as many people as possible. In my unit, our approach has been try and work with good people. So we sometimes take people who don't have all the skills that they need yet, but we can see that they can learn to do them. So people can learn to do almost anything. I always think it's important to think, would I like to work with this person? There are maybe some people you wouldn't like to work with, but you only know that by watching them, seeing what they do, how they interact with other people, and by talking to them yourself. So nobody minds keenness, nobody minds people approaching them and asking lots of questions. And as I was saying to some people in the speed mentoring session, nobody is a mind reader. No one is thinking, I wonder if that person's had enough research opportunities. You have to go to people because they're busy and they don't always know your interests. So tell them. Thank you.
We have time for one more question if anyone has any other questions. Yeah.
Right. So thank you for your presentation. We talked about how in finding a project, we need to decide or show to others this is important and we should do it now by us. I'm wondering, does it ever occur, like how does this interact with imposter syndrome? Sometimes if I start to look into a project, I'll start to think, maybe this doesn't have to be done by me. Maybe this is not the most urgent thing in the years to figure out. How to be assertive while also being humble, or how do you balance this out?
Some of the most enjoyable things in my working week are when someone comes to the door of my office and says, I've had an idea. That is so exciting. Now, I have to say my own ideas are often just very vague ideas and they take discussion to take shape. So you might say, well, Erica, I'm really interested in this thing, this sort of area. And often it takes a lot of discussion, a lot of preparatory work, a lot of reading to say, what is the project we could do here? So also don't be discouraged if people push back and say, why are you interested in that? Tell me more about it. So do your homework, try and understand what it is that interests you. Has anyone else done it before? It's very important that, as our previous speaker was saying, that research is replicated. So there's nothing wrong with doing something that other people are also working on, provided you've got some unique angle that you can explore. But research is a very robust culture. Be prepared to defend if someone says, why are you interested in that? Why are you bringing that to me? It doesn't mean that they think you're wrong. It might just mean that they need more to understand what it is that you're interested in. So tell them. Prepare your arguments and explain why you think we should go down this path. Now, if that's something that the lab or the unit is not working on, you might really need to justify why we should branch out into this new area. I'm probably not the person to give advice on taking a lot of opportunities to branch out, but really people are interested in ideas in research. And so I think if you've got an idea and you might have to work out how you articulate it. That takes practice. But by talking to other people, that's how you hone those ideas into something that you can run with.
Thank you. That's very helpful.
Thank you. Thank you.
Great, thanks. If everyone can join me in thanking Professor Wood again.